important question. The world is changing at a faster pace than ever before. An aging and diverse population living for longer with greater, more complex health needs, alongside many technical advances which require new models of care that in turn mean we have to do things differently, more creatively and more effectively. As we're all living longer and having better outcomes overall, I think the demand we're putting on our health services feels so different to everything that's gone before it. We all have greater expectations, I think, of what we mean by healthcare. The almost the depaternalization of healthcare, I think, is a really important thing here. You know, I reflect on my grandparents who would say, you know, doctor knows best, and we're very much passive in that experience. So it's not just the fact that we're all aging is a factor in living longer, but the types of options we have. You can't go a week where we hear something in the news, read something in the newspapers that healthcare, a new advance has been made in X or Y, and that's always amazing. And people who metaphorically had the door closed in front of them, 5-10 years ago, are now have options, and that's great. But that changes the nature and the complexity of demand. And so thinking we can provide services with a model of workforce, a way of working that was great 20, 30 years ago, we can't truly believe that that's going to sustain us moving forward. And for me, that's really one of the key reasons why workforce transformation is so important.
I think that's absolutely right, Andrew. I was talking about this with a colleague this morning, just on that point about our changing understanding of what care actually is. So as you say, the great complexity in terms of our lives, needs, and also desire. So what I might want in terms of my care for the same condition as, say, you had it, we might want quite different things in how we receive that care, where we receive it. The idea that perhaps, that the paternalistic and kind of very physical, there is a doctor you go to or a hospital you go to, that's what care is. We go, exchange, get fixed, come back, to shifting ideas about how health is a community responsibility. Perhaps there are opportunities for workforces to facilitate communities to take care, to find their own care solutions rather than just that transactional piece. So lots of change, lots of complexity, and therefore lots of thinking need to be worked through to really focus on the service user rather than, well, it doesn't fit our mental model.
Absolutely. And I think as well, workforce transformation, almost, it's got there's a sense of it's a nice to do. When we've got time, we'll think about this workforce transformation, where actually it's a critical ingredient of sustainability and sustainable services, whatever those services are moving forward. And there are input pressures. So we all know, as an aging population, we've got an aging workforce, real supply challenges at the other end of the age spectrum. So transforming how people enter the healthcare workforce, transforming their careers, that frankly they will want to stay working in healthcare, alongside of the population health pressures, the expectations we have as society, and what we actually can realistically deliver, are all bubbles that are sort of floating around. And I think to not think about the workforce when we think about our services, our models of care, how we construct those interfaces, I think we do so because we can redesign pathways, models of care, service plans, etc., but those models will only live and breathe by the workforce that's executing those plans, those care models. So for me, although I've worked in workforce development, workforce transformation for many years now, it really feels that this is the absolute critical moment where we really need to engage with it. It's part of the day job. It's not something that sits in the margins of our practice, and we have to embrace it moving forward.
Well, what you're saying is it's a strategic priority as opposed to kind of a reactive nice to have. This is complex work that requires good quality, strategic practice, scenario planning, taking into account all of those variables. And like you mentioned, the actual expectations of a younger workforce coming in are very different in terms of what they want from work, what's expected in terms of learning at work, in terms of development, in terms of flexibility, agility, to add into all of those other things we've said, and see and really recognize that it's a senior executive strategic priority rather than a workforce they're over there doing something that I'm not really concerned about because I've got better things to think about. Seems like we're saying it's the number one issue, really.